to another week of the RevMD podcast. I'm your host, Dr. Heather Signorelli. If you guys don't know me and our company, I work with National Revenue Consulting. We are a full service medical billing and coding company based in Denver. Actually going to be relocating to the South Carolina area next summer. So looking forward to that. And my husband and I run the company together, and we help practices, really have a reliable and data-driven medical billing service. And we're all about the metrics. And I have to emphasize that because, I'm a big fan of, really understanding, okay, what are our metrics? What are our benchmarks? How are we going to set KPIs around things and how to keep things on track? And so our team is very data-driven. We have metrics we pull every week just to manage the day-to-day billing process. We're in softwares that really enable us to look at data better. And then we pull mid-month metrics and end-of-month metrics and end-of-month dashboards for our practices. And I personally review all of those. Our managers review them and provide their summary. And then our managers are working with the clients to help figure out, okay, we've got some metrics, we got things that are going well, things that there's opportunity. How do we get things where we want? And so it's a full-time, constant management cycle. It's working these claims is not always easy, and fighting with insurance companies is sometimes a lot more work than I think we would all like, but it is just reality of healthcare insurance today. And so our goal is to just figure out the nuances and the rules around, specific practices, billing claims, and figuring out how can we impact and improve things in the front office? How can we impact and improve things on the billing side? And so this week, we are going to talk about the quality payment program with Medicare. This was some questions have come up about this with some of our own clients, and thought, okay, well, let's just talk about this and help folks understand a little bit more about this quality payment program. So you guys know this is really all about Medicare. So Medicare QPP is, this evolving landscape of healthcare. I think we all face challenges when it comes to the administrative burden, but when it does come to growing your revenue, it is kind of one of those things you just kind of got to do if you accept Medicare. And actually, I have to say, I really like billing for Medicare. I think Medicare is simple. I think their rules are straightforward. You follow the rules, you get paid, and they actually pay fairly quickly. I think the key is when you're seeing Medicare denials, you've got to understand, okay, what rule am I breaking, right? And how do I go figure out what the rules are around that? And so they have very clear rules around what ICD-10 codes go with which CPT codes. And again, I'm not saying the others don't. I just feel like Medicare is out there more. You can Google it and find it. It's on the CMS website. Again, I'm not here to knock Medicare. I actually think Medicare is one of those payers that we enjoy working with. So today we're going to talk again about that Medicare quality payment program. And we're going to kind of talk about some of its objectives. We're going to talk about the two pathways that are available to physicians, and then some of those detailed mechanics around MIPS. So for those of you who don't know, that is the merit-based incentive payment system. So MIPS is one of those pathways for QPP. So why do we have QPP? So QPP, the intent of this is to promote this value-based healthcare. The idea behind it was to incentivize healthcare providers to focus on some of those quality and performance improvement activities. QPP was developed by CMS to kind of shift that reimbursement model from fee-for-service to a more patient-centered, outcomes-driven approach. I'm not going to get into the intricacies and the controversies on whether or not it's done that job. We're just going to talk about it's here. So how do we manage it? So again, if you think high level, right, QPP is the program, and they have basically two distinct pathways to choose from for physicians that are eligible. So there's the merit-based incentive payment program. So again, that's the MIPS, and then the advanced alternative payments model. And while APM caters to clinicians involved in innovative payment models, our focus today is really going to be all about the MIPS program. And we'll touch on kind of the four pathways four categories for MIPS. And if you guys don't know, there's a really good, easy website to get into all of this. It's qpp.cms.gov. And so it has a section on the quality payment program overview. It talks about this, which really kind of started back in 2017. It also has on its homepage the check your participation status. So you put in your MPI number, and it allows you to see if you're eligible to participate. And there are some reasons why you wouldn't be eligible, which we'll talk about today. Let's talk about MIPS. I actually first will tell you when you don't need to participate, and that there's really some exceptions that are very specific around, are you in your first year of Medicare enrollment, right? Is this your first year providing care for Medicare patients? That's usually a transition period and you're excluded. Low volume providers, and then and that can be low number of patients and then low dollars that you're billing for Part B Medicare. So again, both of those. And then for MIPS, if you are instead choosing the other track, right, so that advanced APM track, you don't need to participate in MIPS. So again, for the quality payment program, that QPP, there's MIPS, and then there's the advanced APM track. Again, we're not going to talk about that advanced track today. We're just going to talk about MIPS. This has 4 different performance categories, which each are going to contribute to a performance score, which is a 0 to 100 score that you're going to, have calculated for you. Someone else calculates it for you. You kind of provide the data in these categories, and then that score is provided to you. And then we'll talk a bit about what that score then can translate to. 4 categories. First is quality category. And this is the category that evaluates the quality of care, essentially, that is provided by the clinician or by the physician. And there are multiple different types of clinicians that are eligible to participate in MIPS. So it's not just physicians. And those can also there's a long list of those on the MIPS website. So again, that quality section really involves reporting on various quality measures that are going to be specific to the clinician's subspecialty. And there are subspecialty specific things you can look up. Some of that is on the CMS website. Some of it is provided in webinars by the subspecialty organizations that, we all kind of belong to. Again, this is really all about improving patient outcomes and quality related to that.
I will note you can get information in regards to the quality measures that make sense for you on the CMS website. There's an Excel document you can pull down and actually look and see which of these make sense. There are subspecialty ones that are specific, like I mentioned, and there are general ones, everything from, hey, I've got hemoglobin A1C and how many of my patients are above 9%, down to very specific ones for ophthalmology or cardiology. So you can go take a look and see these. And again, you're going to pick 6 of those to measure. And there are some requirements about how you pick those. And there are some subspecialty sets that you can choose from. Again, just depends on the subspecialty you're in and how you want to qualify these and what patients you see. So all of that can be, again, found on the CMS website in regards to quality measures and how you're going to measure them, what the goal is, and then ways to, of course, track that throughout the year so that you can submit them at the end of the reporting year.
The next is what is called the PI category, which stands for Promoting Interoperability. And this used to be known as the Advancing Care Information category, but now this is really all about basically, are you using EHR technology? And it's really about kind of improving the coordination of care by being able to have that exchange of health information. So that is what's called the PI category.
Some specifics about the PI category that are important to recognize. There are a number of EHRs that are certified and will help you select the data that you need to submit. For example, in prior years, this was about e-prescribing. Some of that is now required. So they will provide the details around the data you need to submit. And there are several categories of data around this PI that you need to provide to kind of get those points and check this off the box. And each of these categories has a different weight or a different percent of how it impacts that total score of 0 to 100. Again, all of this detail is on the CMS website. I'm not going to go into all of it, but it is there, and it is important to recognize that each category has its own percent or weight. And for some of the categories, like we'll talk about with cost, they aren't actually something that you submit data to. It is something that can contribute to your total score if you qualify or you have enough cases. Otherwise, it is going to be spread against the ones that you can and will submit data on.
The third category is called the improvement activities category. And this is the activity that focuses on clinicians' engagement and activities that promote practice improvement and patient engagement. There's some great examples of this online on the website that I shared earlier, which again is that qpp.cms.gov, and that will allow you to select each of these different 4 categories and download Excel spreadsheets and measures and data that is going to be necessary to collect and submit to Medicare. Participation in these activities basically just demonstrates that you are out there to enhance the overall quality of healthcare delivery. And then the fourth is called the cost category. So the cost category basically evaluates the total cost of care attributed to a clinician or group. And it assesses this both by looking at direct and indirect cost associated with that patient care. Obviously, a lower cost of care without compromising quality, so again, that's the key here, is going to lead to higher scores in this category. And we'll go into each of these here in a minute. I will just share that you can identify kind of activities for participation through that QPP website, which is going to provide things that you can do in each of those 4 categories. Now, it is important to recognize that there are several different ways to submit this data. So you can do it through some registries, you can do it in some EHRs and PM softwares, and then some have some CMS specific interfaces that you can utilize. And it is really important to understand, I think, first understand, are you eligible? Because if you are eligible and you're missing out on submitting this, it can impact your reimbursement on Medicare, and you'll get automatic deductions from your Medicare reimbursement. So it is important to kind of pay attention to this and understand, okay, do you qualify, right? Checking your MPI number, checking if you're above those volume thresholds, if you're outside of that first year of Medicare credentialing, and then to understand what are the data submission deadlines so that you can participate in MIPS. And because this is a podcast, I don't want to give dates because I know that those change. So I'm trying to give you the resource of where to go to figure this out and then be able to kind of piece that together. You do have to submit, whatever data you've identified by these specific deadlines. Otherwise, you will have negative payment adjustments the following year. The other thing to understand is back to that kind of score of 0 to 100. That's what's going to be calculated for you. And then you're going to see these adjustments on your EOBs or your ERAs, depending on how those come into your practice. So these can be positive, so you get a little extra bump. These can be neutral, so where that, there's no deduction but no addition, or they can be negative, where they actually deduct, adjustments in subsequent years. And so again, the higher the score is going to allow you to get a positive payment adjustment, while lower scores are going to lead to that payment penalty potentially, so the negative reimbursement. I should also mention that with those QPP, right, there's the 2 traditional tracks that we talked about, traditional MIPS and then the APM performance review. There's technically a third, although I kind of lump it into the traditional MIPS pathways. There's these things called MIPS value pathways. And these MIPS value pathways are kind of like a new reporting option to fulfill those MIPS reporting requirements. This was actually new in 2023. And so you can go to the website, again, that's qpp.cms.gov, and learn about those different MVPs that are available to you. And they are subspecialty specific. And so it's all about quality reporting that is specific to your subspecialty. So it makes it a little bit more meaningful. And there are some different types of options you can actually peruse on their website. So it talks about ED or rheumatology or ophthalmology. And so there's very specific ones so that you can go and take a look at that. I will say that those MVPs are typically available after you've done the traditional pathway first. One of the important things to recognize is the score calculation. So that final MIPS score that I talked about, that 0 to 100, I got a question regarding, the positive, neutral, or negative payments. And so the positive payment adjustment is going to happen when you have a score over 75. If you have a score at 75, exactly at 75, then you'll get that neutral payment. Anything below 75 is going to be that negative payment. So positive if you're above 75, neutral if you're at 75, and negative if you're below 75. You can take a look at that and understand, your score. So if you think about MIPS, you think about QPP, what are those steps you need to do? So first and foremost is going to be for you to check your eligibility. You are going to have to potentially submit some data in order to do that. Then you are able to select a reporting option and then look at a participation option. Then you basically will select and perform your measurement activities throughout that specific year. So say you've been doing that all year, then you're going to verify your final eligibility later that year so that you can submit your data in early 2024. So that's if you had been participating this year, right? So, right now you are going to be, if you've never done this before, you're going to be thinking more about 2024. Now, if you've been doing activities this year for 2023, then later this year, you're going to be submitting that data into early next year. You measure things, all throughout 2023, for example, you submit it in early 2024, and then summer of 2024, you will get feedback and a final score will be available to you. And that's typically early summer. And then that is what's going to impact your 2025 reimbursement. So you can see how 2023 data is actually going to impact 2025 data, delay in terms of how your data impacts your reimbursement. All right. So today we talked about the QPP program. We talked about MIPS, which is one of the ways to qualify for the QPP program. Again, all part of Medicare. And we talked about those 4 categories in terms of data you need to submit or things that you are graded on in terms of the traditional MIPS pathway. And it's important to recognize that we're coming up to a new year, right? So January. So you're going to want to start thinking about, if you haven't done this before, checking your initial eligibility, selecting that reporting option, determining your participation option. So again, these are things like, are you going to be participating as a group or an individual? You're going to want to, if this is your first year, pick that traditional MIPS, and then you can start to report on and collect data. Really, really important to have an EHR partner that is certified so that they can help you collect the data for you so that you can get all of that reporting information downloaded at the specific, data submission time points. Get that, throughout the first quarter, the second quarter, the third quarter, the fourth quarter, and just recognize that there are some things that you kind of report on throughout the year, and then a big data chunk that happens at the end or the Q1 of the year after, and that these adjustments in terms of payment aren't until the following year after that. So, for example, if you are just starting MIPS in 2024 and you're submitting data throughout the year, or you're collecting data, I should say, throughout the year, then in 2025, you submit it, those rates and payments are adjusted in 2026 based on that. And this is all based on a score you get from 0 to 100. That score then determines whether or not you get a positive bump in your Medicare reimbursement, a neutral, or potentially even a negative, depending on, if you're eligible and then you just don't, submit it at all, then, that could potentially negatively impact your reimbursement. Again, lots of different lots of different options for when you would not even need to be eligible. And that a lot has to do with volume of patients and volume of Medicare Part B dollars that you actually bill to Medicare. So again, go check this out, qpp.cms.gov, for important information. Get ready to go see if you're eligible, sign in. If you are eligible, start working on a plan with your team so that you can get that data submitted to Medicare and make sure you get that bump in revenue. All right. Have a great rest of your week, and glad to have you guys on this podcast this week to talk all about CMS quality program, payment program.
I do want to put a little information out there. So National Revenue Consulting, we are creating an 8-week medical billing course. So we've been asked for this multiple times. Hey, can you do consulting? Can you do a medical billing course? Can you help teach our front desk? So we are creating an 8-week course, which kind of really encompasses all of that. So we're going to talk about everything from the claims process and risks involved and how you identify those down to front desk responsibility. We're going to talk about top coding errors. We're going to talk about credentialing. We're going to talk about all the things that kind of help make a practice successful and help it thrive. So that is actually going to be the name of the course. It's going to be Thrive in regards to your medical billing practice and revenue. We are going to release this in early January 2024. If you are interested, head over to our website, nationalrevenueconsulting.com, go to billing education and sign up for our wait list. We are also going to have an accountability group and a special VIP membership for those who want to meet weekly, want to go over their metrics, want to set accountability within their teams, and even get sample policies and procedures and checklists so that you can implement those early on in 2024 and really set the year off to a record year. So head on over to National Revenue Consulting and sign up for the waitlist. Thanks so much.
All right. Have a good weekend. Bye.